This video demonstrates the UK's first microwave ablation of benign thyroid nodules performed at the Princess Royal University Hospital site of King's College Hospital in London. The procedures were performed in accordance with the NICE guidelines. We have treated patients with symptomatic benign thyroid nodules. The initial diagnostic ultrasound demonstrated a benign U2 thyroid nodule. Benign nature was confirmed on fine needle aspiration, graded U-Thy2. The patient was consented during pre-assessment. The WHO checklist was completed prior to commencing the procedure. The procedure was carried out in accordance with the British Society of Interventional Radiology Procedure Bleeding Risk Guidance. The patient was comfortably positioned and the room arranged ergonomically for the procedure, initially performed under proctorship. The pre-procedure ultrasound was performed following administration of microbubble ultrasound contrast to delineate the solid enhancing components of the benign thyroid nodule. The trolley was laid out to facilitate aseptic microwave antenna placement under local anesthesia and direct ultrasound visualization. The skin was prepped with cleaning solution and drapes applied. Local anesthesia was administered with 1% lignocaine. The skin was punctured using an 11 scalpel blade once the local anesthesia was fully effective. The microwave antenna was sited within the nodule under direct ultrasound visualization. Initial ablation was performed at 15 watts with continuous ultrasound scanning. Conversation was maintained with the patient to monitor for any voice changes. The patient was asked to report any symptoms during the ablation, such as sensation of heat. Ablation at this low wattage permits clear visualization of the ablation zone with little artifactual image degradation. The antenna was manipulated as required and the treatment was completed at 20 watts. Treatment was stopped once over 80% of the nodule was visually ablated. Tract ablation was performed to ensure hemostasis. The post-procedure ultrasound was performed following administration of microbubble ultrasound contrast and demonstrated minimal residual enhancing nodule tissue. A dressing and an ice pack were applied and the patient was recovered in the interventional radiology day case unit. The patient provided feedback following the procedure. I am most grateful for the minimally invasive nature of the procedure and the ability to have it done with so little disruption over the course of the morning without general anaesthetic or extended hospital stay. The team was very professional and supportive, made sure I was comfortable at all times, and everything was clearly explained to me before the operation. The procedure itself was painless, and so far with no side effects, and I was able to function same as the morning I came to the hospital by the time I left, with almost no signs of having undergone the operation, and feel reassured I will have no visible scars as a result. Once again, my most sincere thanks and gratitude to both of you and the team for excellent and compassionate care I received while undergoing the procedure and selecting me as first patient in the UK to be able to receive this new treatment. Thank you for watching this video on percutaneous microwave benign thyroid nodule ablation performed at the Princess Royal University Hospital in Bromley.